Drink some Benadryl.
Cold, you're gay.
No, it's here on the side, right?
Christine, is it cold?
Oh my goodness, Christina, are you okay?
No, I'm itchy.
What's up with you?
Oh my God.
Okay, so
That's
what
not
do you have?
supposed to happen.
Okay, seated in the chair, arm on the bed, and I'm going to be seated next to you. I need a nice towel. That'll work. Oh, guys, how do you handle laundry? Right, do you guys, does someone have access to, right, yeah. Okay, first time we've had laundry issues, okay. Usually people volunteer to do a load, definitely after today's session because of ultrasound. We're gonna have ultrasound gel over all the towels, so the towels are all gonna have to be washed. So someone who has access to a washer dryer in their house should really volunteer to take it, throw a load in. If people are having to go to a laundromat, that is not who should do the laundry.
I could do it.
Yeah, what's up, Need to subtract that too from our tuition.
I don't want to know that. Okay.
Borrow it. We'll bring it back.
We'll bring it back.
Okay. I want to know nothing about this. Okay. Okay. So ice massage. Why do we do ice massage? Ice massage is very uncomfortable. Why do we do it? Because we want to desensitize an area for a coming treatment. Usually that's transverse friction massage. So we know that this is a treatment that is used with tendinitis. So generally, what would our objective findings be? Where's your pain?
Right here.
Oh, all the way up there.
Happened yesterday.
Huh.
Ball so hard.
Is that what it was? Bowling?
No, dodgeball.
It was the Olympics,
Yeah,
the
that was it,
Dominican
yeah.
College Olympics. That's so fun. Okay, so what brings on this pain? When you're activating what muscle do you feel it?
They're just doing a curl.
Doing a curl.
Yeah, curl, right.
Okay, so active range of motion without resistance. So do that again, and what's your pain level? Scale of 0 to 10.
4.
Wow. So that's significant. So it's
Deep.
not even I put resistance on it, because that's most of your tendinitises will be patient is able to lift a 1 pound weight without any increased pain, but not 2. So that would be my assessment for a tendinitis. I'd be measuring how much they would be able to do without pain. So I want to keep my finger on the spot. So I have my outcome measure. Do it one more time, just make sure that that you're comfortable. You think that's a 4 out of 10? Is it a little more, a little less? Or you think that's the number?
3 or 4.
3 or a 4, okay. So what I'm going to do is I'm going to do ice massage, and then I'm going to do transverse friction massage. So I'm going to be digging in here, going against like that. Is that the most painful area right there?
That lump
or
that
is
just
it
went over.
that lump?
Yeah.
So right there.
Yeah.
Okay. Okay. So it is deep in there. I can feel it. He reports that I'm in the right spot. I'm going to invest time in this. I really want to make sure I'm in the right spot. Okay? So I'm here, and I am going to check the skin first, ask about contraindications, everything like that. As far as this, I wouldn't expect there being much. I want to have this here because I don't want it to drip, and that's uncomfortable. So I'm going to use, if I'm like this, I'm going to be running out of gas soon. Can you just hold that there? Then I'm going to stand up, and this way I can use the bigger muscles in my arm instead of, I'm better off like this. And I'm going to try to do this for 3 minutes.
What about, I always was shown you have to do it really fast, little circles. Is that just a different way to do it?
I don't know that it matters.
Okay.
I've seen that.
But you don't want to hold it, obviously.
I'm not
in
gonna-
one place. Yeah.
The really fast, I'm guessing, is that it would give them little breaks in the ice exposure as opposed to just back and forth. So the circles would give like 1/8 of a second without any ice on it, so that may be better tolerated.
Maybe that's on the, if like that's on a thinner area that's like superficial.
I was gonna say, I feel like I always do it on the Achilles.
He's trying to go deep.
This is to prepare him for the friction massage?
Yeah, I'm gonna do transverse friction next time. Am I up to a minute yet?
Almost. A couple of seconds. Now you're up to a minute.
Say no.
I'm gonna do 2 minutes.
I can't move my hand. I would have done it. Like Michael Jackson.
Yeah, so I have some toothpicks here, or whatever there is. We'll popsicle sticks. We'll fill this up before we go for lunch, and maybe they'll be available. No, it's not a pressure thing. This is just temperature. I'm gonna dig in soon though.
Have you, what do you use at your clinic to like fill up the ice cups? We have like paper cups. We use like.
Yeah, paper cups with the sticks. Yeah.
Not the plastic one.
They have the popsicle things here. That's pretty nice, actually.
And Jenny, do you guys have the blue one?
Yeah.
Those are so good. That's 2
I know, but when
minutes.
people don't fill 'em up
2
all
minutes.
the way,
Okay, good. So let's put this back away,
All the way.
so we don't lose that.
it just crack.
Sorry. Keep in there, right? Okay. So transverse friction. I'm digging in deep. I'm perpendicular to the tissue, and I'm digging. How was that?
That's not bad.
Oh, so then in assessment you could put decreased.
Well, what I'm going to look at is his active range of motion against gravity pain level. I have a 3 to 4 as my pre.
How many outcomes would you want to list? Just one?
One is more than almost every therapist is doing.
Get more than that, but still not.
Yeah, I'm digging in deeper
Yeah.
too. Getting my groove up. I remember last time I did transverse massage.
I was gonna say.
Tell me when I'm 2 minutes on the TFM. I'm gonna stop there.
Do you check immediately after you're done? Is active?
I will just because I'm here. In real life, it would be after the session.
I mean, 90 seconds, not a minute.
That's a minute and a half.
Yeah, a minute and a half.
You had a minute and 20.
I'm losing my mind.
But it's like as little as 30 seconds.
Clearly impossible.
When you're working with patients, you always want to keep eye contact. You want to see what's going on. We had a student that almost failed in a fill. They were doing fine on the fill. Patient had a crush injury to the hand, and the patient therapist had to measure range of motion at all the hand joints. And so they were all paranoid, like, oh my God, there's so many joints. They were trying to be very detail oriented. That's all I got. So they were focused on the hand and writing and numbers, and as they were going through, the patient was crying. They had no idea. And the CI had to stop them, say, you've got to look at the patient, it's not the hand. And she almost failed for that. So, yeah, always keep eye contact. Okay, let's see. A little less. Okay. So a little less. Do we want to quantify him and ask him to put a number?
Yeah, wouldn't change it.
Still the same.
Yeah.
Still 3 to 4.
Yeah.
3 to 4, but a little less.
Solid
I
three.
don't know what to say that means.
Solid 2?
Cold 3.
He won't call. Oh, with 3. Okay. So it went from 3 to 4 to 3.
Yeah.
Okay? There we go. Now we have something. Okay. So I'm going to fill up the water thing. Let's try to make a few more of these for later.